Hello, everyone. Welcome back to St. Louis Teens. We are honored to have with us today Dr. Adam Bailey, who is a physician and a postdoctoral researcher in the Department of Clinical Pathology and Immunology at Washington University in St. Louis. Dr. Bailey, you have been instrumental in several research projects with the COVID-19 pandemic and SARS-CoV-2 virus at Washington University. We want to thank you and thank all the researchers around our country for your efforts in making the COVID vaccine a reality today. Dr. Bailey, thank you so much for being here with us today. Can you tell us a little bit more about how the pandemic has changed your life and your role at Washington University in meeting the heightened needs for research?
Well, thank you for having me. Um, yeah, so I've been interested in viruses and emerging viruses and outbreaks for a long time. So I was already working on actually yellow fever virus, which is another emerging virus that kills many people every year. When we started to recognize that the virus and reports out of Wuhan were going to be a significant problem. And so I essentially transitioned everything I was doing over to working on coronavirus full time about a year ago, actually. So February of 2020. And so that completely changed my entire research program. And we had to develop all sorts of techniques and tools for working with coronavirus. So that was a real learning experience. Um, And then, during the shutdown, it was a little weird on campus because there was really nobody around. And so we would kind of just we didn't have the support staff we really needed either. And so if we needed things, we would just kind of ask other labs if we could go into their lab and take it. And so it was kind of a free for all. Things have slowly returned to a bit of a normal, although they're not entirely back to normal, but the research labs are almost back at full capacity. So on a day-to-day level, aside from everybody wearing masks and social distancing, it hasn't been all that different. One of the plus sides of doing the work I do is that we in the laboratory when we're working with coronavirus, we wear powered air purifying respirators. And so you don't need to socially distance when you're wearing those. One of the small advantages.
And Dr. Bailey, some of your research work involves the study of biology and life cycle of the SARS-CoV-2 virus. And how close are we to recognizing why some people are more susceptible to severe diseases? And what does your research show so far?
Yeah, it's a good question. We know from the clinical data that certain what we call comorbid conditions, so these are other diseases that people already have, diabetes, heart disease, and age, and male sex too, can predispose people to worse outcomes, but we really don't have a good idea yet as to why that is. Um, Part of the problem is when you're trying to study a complex disease process like this, you often need to rely on animal models as systems to interrogate things. Um, and a big problem we have is how do you recapitulate 60 years of unhealthy living in a laboratory mouse? And the short answer is you can't. So coming up with ways to try and get around that. But this is somewhat of a uniquely human disease, and it's a disease that's unique to older, unhealthier humans. And so, how do you actually model that in a laboratory where you can start to tease that apart? We don't have good systems yet. People are working on this, but we're not close.
And with regards to the safety of the current vaccine manufactured by Pfizer and Moderna, do you have any personal concerns?
So I got my second dose of the Pfizer vaccine about a week and a half ago, and I had no adverse events. I think um, there's a couple issues here. I think One is the fact that we've never made a vaccine to coronavirus before, and we've also never used the quote RNA vaccine platform to make a vaccine before. And so, in theory, the RNA platform should be extremely safe, and that is what's bearing out. I think there's also it is good for your listeners to understand the difference between a side effect, which is a term that is commonly misused, and an intended effect of the vaccine. So the vaccine is supposed to elicit an immune response, and immune responses generally don't make people feel very good. So the fact that you have a tender lymph node or you feel like you have a fever, it's not really a side effect. It's actually like the vaccine is doing what it's supposed to be doing. Um, More serious side effects, such as anaphylaxis after getting the vaccine, those have been reported. They're quite rare. So, in terms of the safety profile, so far what we're seeing is the vaccine is very good. Um, Obviously, when we think about cost benefit ratios to society in terms of vaccination, you have to consider not only how safe is the vaccine, but how good is it going to work? And
Right.
that's something we just don't have a good answer to, and time will tell. Over time, people's levels of immunity that come as a response to the vaccine, those will start to diminish. And at what point are they going to become susceptible to infection again? And at what point will those infections then lead to disease and hospitalization? Um, all of those are big unknowns.
And I think one of the things you sort of covered there was that this is really something new. This is, a new first time for COVID vaccine and first time really using that RNA platform. So given that all of this is sort of a new experience, what are some of the common questions about the vaccine that you get asked about?
Kind of what you've already asked. I mean, people want to know, did you have any side effects? What are the risks? Um, People want to, depending on who you talk to. I mean, I talk to a lot of scientific colleagues, and so the questions are often maybe a little more sophisticated and oriented towards understanding the epidemiology. And so, how many people do we need to vaccinate to achieve what's called herd immunity? That would be the number of people needed to vaccinate to stop the spread in the community. And then, depending on what that threshold is, whether it's 85%, 90%, something in that range, then how long is it going to take us to get there with current vaccination rates?
Right.
And how much is vaccine hesitancy going to impact our ability to achieve herd immunity? Those are issues that we talk about a lot, but we don't have good answers to either. And I'm on the basic science side of things, and this is really more of a question for the policy and epidemiologists. But no, everybody's kind of just doing the best they can right now in these unprecedented times. So
And I think that point of reaching that herd immunity, we have to be able to vaccinate a certain number or a certain population. And letting people know that the vaccine is available is also something that can be important. And with my platform, covidvaccinenotified.com, notifying unhoused and uninsured and underserved communities in St. Louis when the vaccine becomes available in their area, I came across people who were skeptical about the vaccine and don't necessarily intend to get it. However, it appears that their only source of information is the media. And how can we provide these groups of people with accurate medical information so that they can make a best, well informed decision?
well, I think talking about it more and having trusted experts on talk shows and what you're doing, I think is good. I think having people plugged into the healthcare system initially so that they have a primary care physician that they see in normal times that is able to establish a good relationship with those people, and people can trust them. I think that goes a long way too. And unfortunately, we don't really have a good track record of doing that in our country. And so just better access to healthcare in general, I think would help with this issue. The other thing that I think is important to recognize from a vaccine hesitancy perspective is that people are coming at this from very different backgrounds, and the reasons for vaccine hesitancy are often quite variable and vary by demographic as well. And so, one example would be that, um, you know, more recently we've seen kind of upper middle class white folks who um, really got scared with the whole autism conspiracy that, vaccines cause autism, which has been shown again and again not to be true. But this has kind of taken root with sort of that demographic. And that's very different from the demographic of, poor Black folks across the United States, but particularly in the South, who have not been treated very well by the medical community and been basically treated as guinea pigs in famous experiments like Tuskegee going back a long time, and so can't really blame people for being hesitant and not trusting a institution that has not traditionally not done very right by them. So the us in the medical community have a lot of work to do in terms of building trust. But I think recognizing that these people are coming to this issue from different perspectives is a good place to start, because it can help you tailor your message to what their concerns are.
And I think you bring up a good point, and I want to transition over to another sort of subset of the population. What has your experience been about COVID-19 infection in kids and teens, and what are the prospects for a COVID-19 vaccine for those under the age of 16?
Yeah, I mean, one of the saving graces of this pandemic is the fact that kids are largely unaffected. I mean, there are examples of kids being hospitalized with um, strange COVID-19 manifestations, but in general, this virus does not seem to be able to infect little kids very well, and um, it seems to be able to infect teenagers pretty well, but doesn't make them sick. And I think it it's an interesting thought experiment to think about how this would be different if that were not the case. Like if this killed kids at a much higher rate than um, adults, I think our society would really be in a very different place than we are right now. And that is totally within the realm of possibility for a virus if you look at 1918 influenza, et cetera. So I think we are essentially just got lucky that this doesn't affect kids. Um, I have two daughters, two young kids in daycare, and I don't know if I would be willing to send them to daycare if if it posed a significant risk to them. So that's been a huge weight off, I think, for a lot of people. Um, in terms of vaccination of kids, it's not really the regulatory system is going to have to cross that bridge at some point, and I think um, vaccination of kids will probably they'll start with 18-year-olds and kind of work their way down and look for any adverse events. I don't expect there to really be more in kids than there would be in adults. Um, but the good news is that we have time for that, because they are a much less susceptible population, both in terms of infection and disease. It will be important to vaccinate college and high school age kids, because they're likely still spreading it, even though they are not experiencing disease.
Yeah.
So that all still needs to be kind of worked out. And I think right now, given that we have a vaccine shortage, um, kids are going to be kind of pretty far down the line. um,
But I think, when talking about that group of college students and high school students, as many of us are eager to get back to schooling and outings and sports, how can teens and youth be a part of the solution and help your efforts in ending this pandemic?
Yeah, I mean, I think just doing what everybody is trying to do in terms of being good about wearing masks, being good about social distancing. I mean, it's hard for everybody, and nobody's perfect, but really making an effort and recognizing that you really can't tell if you or the person you're talking to is infectious. And so, keeping that in mind, um, we've seen that if people adhere to the basic stuff, masking, social distancing, hand hygiene, all that stuff, you really don't need a vaccine to slow the spread. So just keep doing those things.
Dr. Bailey, we thank you so much for your persistent efforts in helping us understand more about the virus and potential ways to fight it. And thank you so much for your time today and answering all of our questions.